Hello, my name is Dr. Michael Boggess. I'm a double board certified facial plastic surgeon, and my practice is called Youthful Reflections, located in Brentwood, Tennessee on the south side of Nashville. This is a very complex question because there have been many different techniques described for performing facelifts and the terminology is not consistent. However, all properly performed facelift procedures employ a certain set of basic common principles. First is a variable length incision that extends from the hairline in front of the ear, down in the natural creases along the front of the ear and around the lobule of the ear, and possibly along the back side of the ear and across to the hairline behind the ear to a variable extent depending on the needs of the patient. There may also be a small incision in the natural crease under the chin that allows access to the midline of the neck if needed. The skin of the face and neck is then elevated from the underlying tissue layer called the SMAS in the face and the platysma muscle in the neck. It is this deeper layer of tissue that is lifted and repositioned to recontour the neck and jawline. This layer is more resistant to stretch in the skin and provides a longer lasting result in facelift than just a skin only lift. Once the SMAS and the platysma are elevated to a more youthful position, the excess redundant skin that is pulled back with it is trimmed along the incision lines and sutured back in. In addition, some patients may need additional work in the neck that may include liposuction and tightening of the platysma muscle in the midline of the neck to achieve a better result for patients with significant sagging in the neck. The thing that distinguishes one type of facelift from another is typically the management of the SMAS and the platysma muscle during the lifting procedure. The simplest approach is a SMAS plication lift, which involves layering the SMAS over onto itself as the SMAS is elevated and suturing the tissue layers together to sustain the lift. A SMAS imbrication procedure actually involves excising or removing a strip of the SMAS and platysma muscle around the ear and then approximating the free edges as the SMAS and the platysma are elevated to a more youthful position. And lastly, a deep plane facelift is a procedure that involves an additional plane of dissection underneath the SMAS and platysma layers that allows release of ligamentous attachments along the jawline and in the midface to provide additional mobility of the SMAS and platysma during the lift. The choice of surgical technique is really more dependent upon the skill and experience of the surgeon and the surgeon's preference. There have been no studies to demonstrate any significant improvement in results or longevity of results between these different techniques.